choice this summer, drug-free 24/7. That could be a message from a youth group to other youth in their community. Drug-free 24/7, our summer to remember. Great ways to put this together with a summer campaign. And then there's some other possibilities you can click through. There's another observance example of Home Safety Month and targeting homeowners and renters, where you can ask home improvement businesses such as retail stores, professionals, suppliers, etc., to circulate information to their clients or customers about the connections between alcohol, tobacco, other drugs, and home safety. For example, locking up alcohol and medications in preparation for kids being home for summer, eliminating smoking in the home to reduce the risk of fire, those kinds of things, tying that together and doing it again under the Drug-Free 24/7 banner for consistent branding. And as in April, we also in June have some other observances where you could take the ideas we've provided, use them as a jumping off point for your own thinking, and get creative and look at what you might want to do around Juneteenth, an African American celebration of the Emancipation Proclamation. Maybe there's a way of talking about being free, different than what, there's lots of ways to be free, but are you capitalizing on your freedom by being drug-free 24/7? Maybe there's a tie-in there with a cultural celebration. So as we talk about year-round commitment, you can see there's all 12 months, different levels of information, different ideas in each one. It's really helpful to go through and look at them all because it'll give you some ways of thinking and some ideas. It may not be exactly what you do, but it can be a jumping off point for what you do. All right, so I'm going to take us back to our PowerPoint and real quickly sum up some tips from Drug-Free 24/7, and then we have a few questions that have come in. First tip I have for you is really to not bite off more than you can chew on the first year. I wouldn't try to do something every single month. I would definitely, if you can, plan something to coincide with your Red Ribbon Kickoff for October. And then maybe pick 2 or 3 more, maybe 3 or 4 more that make sense for your community this year and that are spread out enough to give you and your planning group time to do the groundwork for it. And then next year you repeat those and you sprinkle in 4 more on the off months. And then pretty soon another year you've got all 12 months. And we encourage you to do it your way. You don't have to take our examples word for word or as they are. They're really meant to be jumping off points for you to create your own. And those tips are there, and we're here for technical assistance for you as well. And we want to encourage you to use Drug-Free 24/7 to help you reach your community in new ways with a specific message that's consistent but gets you into some new and different ways of reaching people. And that's what we tried to do. We didn't have time to go through all 12 months to see how to do that, but hopefully that'll help. So I see a couple questions did come in, and want to definitely take some time with that. So first thing was, when you say drug-free, are you including tobacco? And that question came from Gail, and absolutely we are. I have a habit of saying alcohol and other drugs rather than saying, and then I say ATOD when I abbreviate it, but that's my fault. Alcohol, tobacco, and other drugs. We have observances in here that are very connected to tobacco, not just the Great American Smokeout, others as well. So absolutely including tobacco in this. Can we use your information off your site without having to give you credit if we adapt them into a year-round plan? That question came from Natalie. When it comes to actual use of the Drug-Free 24/7, the Way to Go logo, when we provide you with that print-ready artwork, one step you'll have to take prior to getting that artwork for free, and we will send it to you in both JPEG and EPS form, so it's print-ready for the printer. We'll just ask you to sign an agreement. Some things that our board of directors requires, like in order to do this project and have it branded with Drug-Free 24/7, you can't take money from the alcohol industry for that and then have their logo down there with it. One of the other things we'll certainly ask is to give us credit in some way, and it can just be presented in partnership with, because we know you want to get your logo for your agency or coalition out there as well. But just giving credit for Drug-Free 24/7. Itself. It can be a very small byline down in your printed materials. And you'll see that in the agreement. But beyond that, your actual design and your strategy is yours. And go to town. And we'd love to hear what you guys do so we can continue to build this toolkit and share that idea with other communities across the nation. So we'd love to hear your ideas and your successes. So please feel free to email those into us at contact@drugfreeactionalliance.org. And it looks like our last question for the day is, how much does implementing drug-free 24/7 cost? For accessing the ideas and the guide that's available online, which you just got a very overview kind of tour of today, it's all free, and we will provide the print-ready artwork to you for free, again, once that agreement is signed, and that'll all take place through our member center that's going to be available on our new website within the next few weeks. And we'll let y'all know when that's available. But when it comes to the actual cost in your community and where else you might have some direct costs, if you did some things where you provided flyers for your pediatricians in your community and asked them to hand that out to every patient when parents get that stack, maybe it's during Alcohol Awareness Month, so you created a great handout and did it under the Drug-Free 24/7 banner. Whatever, if they won't copy it, maybe it's you having the cost of those copies, and ideally color copies, because that's what makes this draw attention, is these great colors in this logo. If you did anything else, you might be able to get some printing donated. There's very, very cheap ways, even free ways, to get this done, and really it's just the cost of printing. If you did want banners, posters, those kinds of things, I forgot to show you, you can certainly use the print-ready artwork to create that yourself. I did forget to show you on our webinar, on our web tour, that we also do have campaign materials, and all of our proceeds fold right back into our agency and support our prevention programming. We are a nonprofit, so it does just help keep us going. But if you didn't want to take the time to create all those printed materials, we already have them, including red ribbons for Red Ribbon Week, and those can be customized with your logo on them as well. So we do have that available to you if you would want to cut out the middleman and do that more directly, or you could do it yourself through having the print-ready artwork available to you. Looks like we do have another question. Will you repeat what you said? Prevention. Prevention is not just a movement, it's a discipline. Prevention is not just a movement, but a discipline. Tamitra wanted that repeated. The first time I heard someone say that, I immediately put it on a poster on my cubicle wall in my office. That was about 15 years ago. That was a very powerful statement. And we really need a marriage of both, the movement and the discipline from the field. Okay, so I'm checking with our other staff with questions that are coming in. It looks like we are in good shape. So I'm going to go ahead and wrap up with some administrative details for everybody. Remind you that to receive your certificate, when you close out of the webinar, an evaluation will automatically be sent to you. You may need to be patient. It may take a minute. I think it should come up automatically on your screen. If not, it's going to come to your inbox in your email. Sometimes GoToWebinar does it different ways, so I'm not sure which way it'll happen today for you. You do need to complete that evaluation, and then you'll be marked as completely participating in it, and then Karen, our staff person, can start working on creating those certificates, and they will be coming out to you via your email address that you used to register for this webinar. And last but not least, if you have questions from here or want other information on the program, I'm actually substituting today for Tony, who had to leave the country unexpectedly due to a family emergency. And so Tony wishes you all well and says hello. That Tony will be our point person for Drug-Free 24/7, and you see his phone number and extension and his direct email address. And if for questions more about your certificates, if something is there's a hiccup in that, somehow you didn't get it after 30 days, be sure to reach out to Karen Downey, and that's her phone number and her direct email as well. So I hope this was helpful for you today. It seemed like a good way to help people understand Drug-Free 24/7 beyond just a short article in our e-news, and thought it would be helpful for folks. So with that, I think we're going to wrap up. And as you sign off, you'll actually have to close out of the webinar before that survey will come up for you. So I hope you all have a great day on what is a gorgeous day, at least here in Ohio, and that you have a good, safe week.